Since yesterday till now, I have been having this mixed feeling. I cannot say I am happy. I cannot say I'm sad. That's this mixed feeling. As in, you know, when you are thinking of other people, not just thinking about yourself, but you also concerned about other people. I'm that person that I am family oriented. Also, when it comes to friends, I am so caring. I make sure I try my best as much as possible to reach out to friends, to check up on them. There is this Nigeria YouTuber, Lovely Family. I love their content. Family of six. They create sweet and lovely content. I'll be following them for quite a long. Four beautiful children and a mother and a father, husband and wife. So I haven't see their content for long. I haven't watched their videos for long. No, their videos have not been popping on my For You page on YouTube community. So yesterday I decided to call her, to message her. She wasn't responding. So after about uh, 3 to 6 minutes, then I on my smart TV. Then a video just pop on. Lord and behold, I saw this lady crying with her husband, wearing black and black. And I was like, quickly, I read the title. This was how we lost our child. Here, my heart just skipped. Bam. And I was like, which child? Because they have four boys and a girl, four children. I was like, what is it? I started watching the video and they explained how it all happened. You see, Nigeria doctors and nurses, you guys can do better. You have to start doing better, especially the nurses, all those quack nurse, all those bend down select nurse. They have took so many lives. I don't know. The other day I was watching this The On Game show by Nurse Mirage, where two nurses cannot even, as in, they can't even talk simple English. Nurse cannot even differentiate, as in communicate. Is that the type of nurse we have in Nigeria? A nurse that cannot even talk fluent English. I don't know how to put it. As in, there is something I have noticed in Nigeria. When somebody is not feeling fine, instead of them to run a test, like here abroad, when you are not feeling fine, what they will do first of all, they will run a checkup, blood test and urine test, first to know what is wrong with you so that they can administer the right treatment to you. But in Nigeria, they'll just carry drip, ma'am. They'll just carry injection, pum. All they know how to treat is typhoid and malaria. Finish. Is it only typhoid and malaria you people sick in Nigeria? You people don't check other sickness. Just typhoid and malaria. The other day, my mom was not feeling fine. They went to call a nurse. The nurse just came and said she wants to fix drip and start giving my mom injection. I told the nurse, I said, you can't do that. Stop it. First of all, take the blood samples, urine test, go run a test, then know the right treatment to give to her. Why will you just come and just start? You just place that this thing on her chest here, then that's just this test, just to check if the heart is okay. Then look at the 2 ears. Is that the only test you are supposed to run on a patient or on a sick person before you administer a treatment on that person? Abroad, yeah, abroad, if you are not feeling fine, even if it's an emergency, the person is quarter to die, all they will do is, first of all, give you this oxygen so that you can breathe very well. Then they'll run a blood test, varieties of blood tests with a urine test, so that they can know the right drugs, the right treatment to give to you. But in this boy's case, according to this YouTuber, Nigeria YouTuber, according to the parents, how they explain it, this child was not feeling fine. They went to the hospital, they fixed a drip, and they gave him injection. They went home. Throughout that night, the child couldn't sleep. At about, what is it? At about um, 12:30 a.m. in the morning, the mother ran outside. You know, it's Nigeria now. The mother ran outside to start looking for taxi, keke, or whatever transport to transport the child back to the hospital. They couldn't find any. They called their neighbor. Their neighbor said the brake of his car is faulty, that he cannot use the car until he's well fixed. So they wait then till in the morning. Then in the morning, they took the boy back to the hospital. Before the arrival of, before they got to the hospital, the boy gave up. The boy gave up just like that. You see the reason why I said running a blood test, urine test is very, very important. Had it been the previous day they went to the hospital, they did the blood test, a urine test for that boy, they would have known the right treatment to give to that boy. Imagine a boy in that condition, they just fixed the drip on him, gave him an injection, discharged them to go home. How? Things like that can never happen abroad. A child that is not feeling good, is not feeling fine, in that state of condition, you just fix drip, gave him an injection, you ask the parents to take him home. Then throughout that night, the boy was running temperature. He couldn't sleep. He couldn't eat. The next day, before they take him back to the hospital, the boy gave up. The boy gave up. Nigeria, all these quack doctors and nurses, especially the nurses, nothing vex me past all those nurses. You see, please, if your child is not feeling fine, not only a child, if you, the parents, anybody, you are not feeling fine, please tell the doctor and the nurses to run tests on you, check up on you. Tell them to run check up on you, blood tests, urine tests, to know the right medicine to give to you. You understand? I did be the run test on that boy, leave the boy on the hospital bed, gave him the right treatment, the boy wouldn't have give up like that. Please, as a human being, as a parent, as an adult, make sure you run complete test before they administer any drugs to you. It is very, very important. Since yesterday, my heart, I'm not just happy because if you are a mother, you know how, you know the pain. You, God.